Hello, Gary Perkins from Sussex First Aid Courses, HCPC paramedic. I would just like to introduce to you the new Medical Emergencies in the Dental Practice Manual. For many years I've been teaching in dental practice, CPD, medical emergency training, and we have also a whole range of different trainers who help me in delivering that package. Now, one thing over the years I've always done as a courtesy is help the dental practices with checking their medications and their emergency pack. And over the years, for those who know me, I'm constantly talking about being rescue ready. There is nothing worse than feeling the pressure when a patient of yours, or indeed a member of staff, is taken ill. The public, the GDC, the UK resuscitation guidelines, the bench has gone higher and higher to the knowledge you should have and the care expectations. With that in mind, medical emergencies, we know, aren't being carried out every day of the week in the dental practices, so it can be a stressful situation. Now, over the years, with my advice and many dental practices, they've been putting together some fantastic kits, colour-coded, in bags, writing out the details, drug dosages and one thing and another. And for a number of years now, a lot of dental practices have been saying, Gary, can you put this together in a package? Well, here it is, Medical Emergencies in a Dental Practice, a very practical colour-coded guide. And a colour-coded guide is there for all the different medical emergencies, signs and symptoms, the management, and then, of course, importantly, the drug dosages are on each page. Now, shortly, I'm just going to run you through this book, but what I will say is now also we have the medical emergency drug package, the drug kit itself, and inside there, here you go, all your pouches are color-coded. Diabetes, epilepsy, asthma, cardiac emergencies, anaphylaxis in yellow there. All your drugs, emergency drugs, need to be in colour-coded pouches. Also, in each pouch, we have the different additional equipment that may be needed. We also have labelled equipment that should be in each pouch, making it so much easier to check on your weekly check-in when you check your list at the end of the week there to make sure it's all in hand. But also in a medical emergency, when you have a patient, let's take anaphylaxis, suffering, you go to the yellow pouch. In there are your drugs and your emergency kit, and then you're able to go to your emergency manual. Now, as a paramedic myself, when we attend medical emergencies, of course, we all have to have such vast knowledge these days, and retaining it is hard work. So there's nothing wrong, and indeed it's encouraged to use medical charts, guidelines to help us in the management of a medical emergency. Airlines, pilots have been doing it for years. If there's a problem up there, open the manual, work through the problem and find the solution. Here is your medical manual that is designed to be kept with your drug kit inside there. Now, I've seen when I go to dental practices many different ways of trying to remember, and sometimes people have on the back of doors or cupboards, they have like medical charts with the drugs. The reality is, in a medical emergency, when it happens, when someone collapses outside in the reception, people forget behind your cupboard door is a list of all their medications and emergency treatments. Keep your manual with your drug kit color coded, so when you need it, you can open it up. Now, in this manual here, this is designed an easy guide to use in a medical emergency, but also use it as team training. You know, if you have a coffee morning, a bit of CPD training just for an hour, a number of my practices do, then run through the manual, making sure you're just happy where everything is, how it works with the package. So this manual have all you need. It's in different sections, guidelines, treatments. And if we just start with the first treatments here, adrenal insufficiency, adrenal crisis management there. That's a condition that many of us should know about. Often we don't feel very confident in knowing about it, and it is quite a rare condition within the dental world. But it's all there. Signs and symptoms, management. Anaphylaxis. I have to say, of all the medical conditions that are out there, and certainly in the dental practice, anaphylaxis is the one that causes many of us to be worried and concerned. In the event of anaphylaxis, then go to the yellow page, go to the yellow pouch in your drug kit there. There they are. There's your signs and symptoms. There's your management plan. There, importantly, are your drug dosages. It's okay for a member of the staff to be going through the different sections as a checklist to ensure you deliver the correct care. It reduces the anxiety, it reduces the chance of any comeback later on from a complaint or something that wasn't done or something wasn't said or treatment wasn't initiated. Let's take asthma. There's a very common condition. There's a blue. There's a flow chart. Each medical emergency will have the flow charts to follow. Again, signs and symptoms management and the drug dosages. Blue goes with the blue pouch in your drug kit. Keep it together. Cardiac emergencies. Cardiac emergencies, we've named it, and generally they're talking about chest pain, someone having a heart attack, angina attack in the dental practice there. Again, flow charts to follow, management, treatment guide, drug dosages. It's all there for you. All up to date with the latest guidelines, the UK Resuscitation Council guidelines, your BNF guidelines from your dental directory. It's all there. Choking, diabetic emergencies, that's quite a common one actually. Again, orange page, orange pouch. It's all about making life very easy and reducing the stress. Epilepsy, just think about it right now. You've got a 4-year-old having a seizure in your dental practice. They've had a seizure for 5 minutes. You need to know the drug dosage. What are we going to do? You've got mum and dad there asking you, what we could do, what we going to do. You need to supply oxygen therapy. You need to get the correct drug dosages. My Daslam, here it is, signs and symptoms, management, your drug dosages for the different age groups. Again, it's color-coded to go with your drug pouch in the kit there. Now, you may already have a colour-coded drug kit. Maybe you got one. Maybe you've got a really good one that you've made yourself. There are others on the market. Well, again, these are colour-coded to the national standards, okay? So this will work with your kit if you already have one. Or you can go on our website and you can buy the combined bundle individually, the book on its own, or you can buy the bag itself to go together as a bundle, making life a lot easier. And then all you need to do is put your medications inside to the kit there. We cover fainting here. For those of you who know me, and in my teaching, often I'm teaching when's a faint, not a faint, when's it's something more sinister. Again, go through the guidelines. Someone's fainted. Most faints in a dental practice are quite straightforward. Again, if you follow the checklist, the guidelines, you'll be sure you get your treatment correct. CPR and defibrillation there. Again, there's your guidelines. Now, a CPR and defibrillation you cover yearly in your CPD, so it's not really the time to be referring to the manual. Hopefully, with good training provider, you're able to carry it out, but it's all there for you if need be. We do these days as paramedics in the event of cardiac arrest. We have, where we can, somebody standing back and running the resuscitation, going through a checklist, making sure we haven't missed anything. Post-resuscitation care. Oxygen therapy. Oxygen therapy, there we are, colour-coded there, can often be quite confusing, and the guidelines are quite comprehensive these days. Thank goodness it's quite simple within the dental world, but here it is again. When to use it, when not to use it, the drug dosages, a patient with COPD. Here is your checklist to follow. So we put it all together, folks, to make life easy for you. Also, just to let you know on the back there, often I have many people asking me what should be in the kit and what quantity should be in there. Well, within this manual, it's all there for you. Checklist. Your medical kit should be checked weekly. That's your drug kits and your oxygen resuscitation primary kit should all be checked. Here I have it all listed for you, okay? And then last of all, on the back there, we have a patient emergency report form. So when you have a medical emergency, relevant information should be collated and then ready to hand over to your emergency crew. And of course, for your own records. So here it is. You can also subscribe £29 yearly to us to receive all the yearly updates. The next update coming out is sepsis within the dental practice. Also, when you subscribe, you get a whole bunch of videos, learning on there, and also you get to download and print off emergency forms, checklists for all your kit. So it's all there to keep you within your guidelines. Okay, so this is a medical emergency manual, easy guide, color-coded guide that we've put together. And my whole idea of putting this together with our team is that it's relevant, it's up to date, it's easy to use, it's color-coded, and it takes the stress away from treating people. It's always going to be stressful when you're treating in a medical emergency. For those of you who've treated someone in a medical emergency, just cast your mind back. I'm sure you had that adrenal rush, you're very nervous, your kit finished up flying everywhere. This is part of trying to reduce the stress, at least giving you all the information there in a quick guide. Okay, should be kept with your drugs kit. I'm going to do another video on the drugs kit very shortly, and when I show the drugs kit, I'm going to be talking about what should be in there, what shouldn't be in there, how to pack it, and how to have it ready. So you can visit our website for the medical manual there, and if you have any questions, and as ever, please do contact us. Thank you.